Be asked to do various performance tests or balance tests, and the investigator will simply rate them on a rating scale, maybe 1 to 5, in terms of how they're performing. Well, those sorts of outcomes are really not very sensitive, and so if we can start to use platforms, like the gaming platforms, for example, to actually make objective measures of some of these parameters, then we've got a more sensitive outcome measure. And we've also got an outcome measure that isn't prone to differences between raters, for example, rating people differently and adding noise into the data. So that's really why we're interested in this, and I think at this point just hand over to Luke, who's going to talk about the different platforms.
Hi everybody, my name is Luke Sinner. I'm a researcher within the Design for Health and Wellbeing Research Department at NTU. So just to quickly give you an overview of what I'm going to talk about. So we're going to quickly talk about the 3D camera systems that exist and the sensors that are involved with that, the benefits of motion capture platforms, and ultimately what areas of industry within the healthcare industry they fit into. And we're going to have a quick comparison of the key components within those in terms of the hardware and the utilities that are involved with that. And also we're going to talk about the understanding within the process of the motion capture. So currently, within the last 10 years, there have been a wide range of 3D camera systems that have been in production and also been involved in research. And they range from the very cheap motion capture webcams, so that are approximately £10 to £15, and then that then steps up to a camera that's maybe something like a Microsoft Kinect or an Intel RealSense that's, say, 3 figures, £100, give or take, including with a development kit. And then that then steps up to a machine vision that can be ultimately a couple of £1,000 for the camera set, and then a high-powered process PC that will ultimately need to be powered that. But within these cameras, there's also sensors such as the Leap Motion category, which also has the free movement of hands to track your hands or other body parts dependent on the program that's set. So within motion capture platforms, ultimately there's a massive potential for these cameras to be used within the market in healthcare industries, whether that's in rehabilitation, stroke management, facial tracking, amongst others. And with that, there's obviously issues that come around accurate tracking in terms of facial recognition, skeletal tracking, and with that it becomes a factor of how can we track these rapid and quick movements and make sure that they're tracked accurately enough to get the data that we need. But also, one of the key areas within facial tracking and rehabilitation is gesture and expression management, and with that we have to make sure that the rehabilitation sector is prepared to be able to give the right clinical studies and the right data to be able to get the outcomes and track that how we need to. So within the rehabilitation sector specifically, there are current platforms such as Neuroformer, Gintronics, Face2Face, amongst others that currently provide these platforms. However, the big issues with these is that actually they cost quite a large amount of money to build. So for example, Neuroformer and Gintronics both require a large TV screen of a 4K standard, a high-powered PC, a Microsoft Kinect, and then actually they require a license to actually run the software and to roll that out within a clinical facility. And these actual licenses cost sometimes between £2,000 and £15,000 per year, depending on the clinical environment. So what are the benefits of motion capture platforms? Well, actually, there are huge amounts of benefits, and it mainly comes to how we manage these motion capture platforms and the facilities that they're run within. So again, going back to rehabilitation, a rehabilitation platform, it allows us to track a numerous number of exercises, and will also allow us to remotely access a rehabilitation platform to be able to change exercise regimes based on a patient's need. So, for example, with stroke, there's always a natural occurrence within a patient that's had a stroke to recover, but the recovery is dependent on the severity of that stroke. So with that, it becomes of how do we set the platform to adjust accordingly, and therefore it actually requires a specialist to review the rehabilitation progress of that patient, and as a result of that make sure that they're prepared to step forward into the next phase without doing further damage. And that's really critical within any healthcare industry, and making sure we don't do further damage based on healthcare treatments that we provide. So two of the main platforms initially within research and clinical trials were the Xbox 360 Connect and the Xbox One Connect, so Connect 1 and Connect 2. The big differences with that become down to the software development kits and ultimately the gesture control, expression management and facial tracking within these platforms. And ultimately, as they progress forward, the sampling rates of these also improve. However, more recently, Intel have decided to step into the game, and they've now provided a software platform and a hardware platform in the form of the Intel RealSense. Now initially that was in the form of the F200, but now that's moved with Intel RealSense into the SR300. And even though these are comparable between the Microsoft Connect and within the RealSense, Intel RealSense are now providing software platforms that potentially could push that even further forward, whereas Microsoft is still developing their current kit. So with the Intel RealSense, for example, already has a combined 3D scanning facility that allows you to merge multiple scans together to create a 3D image, for example, of a person's face or a specific anatomy. So, for example, in an HP Sprout, which an Intel RealSense is built into, you can actually get a full 360-degree scan of a person's hand and then export that into a CAD model where you can then do an analysis on that. So, the Microsoft Connect has been a massive advancement within clinical rehabilitation. However, the industry is starting to change, and some experts are actually starting to get to a point where they're now starting to champion the Intel RealSense rather than the Microsoft Connect. However, Microsoft are currently planning their next rollout of another Connect, so it's going to be interesting to see how these are comparable. But ultimately, why champion the RealSense at the moment? Well, actually, the RealSense is a multi-use camera, and is also being integrated into a number of other areas, such as the automotive industry, and also being built into car sensors as well. So these sensors actually have a higher sampling rate and also allow us at this point to do higher accuracy scanning, higher accuracy tracking, and this can be whether it's in facial rehabilitation, in medical or automotive industries in terms of on the production line. But also the Intel RealSense at the moment also allows us to combine these into other platforms, whether it is an all-in-one PC, whether it's a tablet, or whether it's within even a robotics development kit. So ultimately, at the moment, Intel are now bringing out their next batch of RealSenses in the SR300, and ultimately we now see the progression within that industry. But the Microsoft Connect will be potentially updated again, so we have to wait and see how this progresses. But as of May 2016 this year, when we wrote the paper, Intel RealSense and the Microsoft Connect were very much on par. But over the last couple of months, the Intel RealSense has started to become more and more useful within their software kit development, and ultimately, as that progresses further forward, we're hopefully going to see how these compare again. Thank you.
Great stuff. So I think, as Luke said, real promise in that platform. But in terms of if you go back in the literature and have a look at what people have done, actually there's a lot of literature on Microsoft Connect, and it's partly because of the utility and the availability of that platform. So we're just going to do a little quick review of some of the validation studies that have been done in terms of measuring health outcomes using Connect. We're looking at 4 different areas. We're looking at gait and balance, upper extremity movement, chest wall motion analysis, and some facial analysis. I'm just going to run through these pretty quickly. So, gait and balance, just to start with. So over here we've got an example of this. This is actually a treadmill test. So one of the 5 studies we looked at used a treadmill test, a little bit unusually, but a great idea. This is actually comparing it to the Vicon motion capture system. I don't know if you've come across that one before. You can see here in this diagram we've got about a dozen sensors that are put around the room, and they're doing the 3D imaging of the motion tracking for the patient using the Vicon, and in fact they have these sensors that are put onto various body landmarks to help with that as well. So they in their study they compared Connect to the Vicon, and actually it's things like this, the Vicon system, that make us want to give us an interest in using Connect, because the Vicon system is incredibly expensive. and it's complex to set up as well. And usually when we use this in a clinical trial, and we do use it in clinical trials, we do it in specialist centres. You know, it becomes really quite expensive. So when you move into those phase 3 trials, the very big trials across multiple centres across the world, actually you need something that's a bit more portable, a bit easier to use, and that you can do in non-specialist environments. So Connect offers a really good opportunity to do that. So we looked at 5 different studies, and you know, when it came to gait and balance, actually I think the results were mixed. The studies showed you were able to differentiate different types of patients quite easily, so MS versus healthy normals. You'd expect to be able to do that, really. If we look at this study here, study 4, this was one with various performance tests were conducted. It was in Parkinson's disease and healthy volunteers, and it was against this motion capture system. What that showed, and it's pretty comparable with the other studies, is for gross movements, like, for example, this sit-up to standing test, which you would do in a clinic, and you would time somebody and figure out how long it took them to do that. It was very good and very comparable to this expensive motion capture system. But the finer movements, like a toe tapping test, for example, it was poor at. Okay, and I think some of this comes down to what Luke was describing in terms of the differences between perhaps the RealSense and the Microsoft Connect. The sampling rate on the RealSense is 100 frames a minute. On Connect it's 30. So for fine movements or detailed movements or rapid movements, it probably isn't going to be as good. Upper extremity movements, so you can see here there's a lot of different tests you can do. These are simple performance tests that you might do when you go and see a physiotherapist or your doctor. Again, useful in things like stroke, where you might have limited mobility of one or both of your limbs. And 8 different studies we looked at here, and just to pick one, you know, the top one here. This was a study where they did 3 different performance tests, looking at flexion, abduction and rotation of the shoulder, compared it to a goniometer, which I don't know if you've seen one of those. It's like a big protractor that a physician would use to measure an angle, a joint angle. And they found really good correlations. Oops, I'm thinking that's a pointer. Really good correlations between the traditional method and the Connect. So some really good positive findings there. Chest wall analysis. This was published last year and actually it was reviewed in Nature. I don't know if people saw this. It was a really interesting use of Connect, where they actually used four Connect cameras positioned perpendicularly around a subject, and they got the subject to do a spirometry test. So they had to breathe in as deeply as they could and then breathe out as deeply as they could. And they would do that in a spirometer, so they'd be measuring various lung parameters, but also they could do it from the 3D image of the chest wall. And they found, again, in this study, really good correlation between the two approaches. And then just finally, Luke's already mentioned this, the face-to-face solution. You know, this hasn't really been used to make measurement. I guess it's been used more to encourage the correct exercising for patients with Bell's palsy and facial paralysis due to stroke. But you could see quite easily how actually you could make objective measurements from the data that you're collecting during those exercises and then track improvement over time and potentially demonstrate treatment effects. And we actually see facial muscle weaknesses is a problem for a lot of CNS indications, not just, you know, stroke and Bell's palsy, so it's quite useful. So I think just to summarise that piece then, so we think that Connect seems to be pretty good to measure to measure gross movements, but the fine or the rapid movements are more difficult. And if you drill into some of the literature, some people use advanced methods on top of what you get in the software development kit to help to enhance the way that it measures. So for example, increasing the sampling rate from 30 to 100 frames a minute using some interpolation algorithms, or doing other things to try to improve the resolution of the camera and using other landmarks, for example, as opposed to just the joint measures. But we're seeing that it looks promising in certain areas, and particularly that things like the upper extremity movements, which again, in a clinical trial, we would rate on a 5-point scale with an investigator. So being able to do that in a low-cost approach in a large-scale clinical trial would add incredible value. So just 2 more slides. Just an example of what we've been working on at ICON. So we've been developing a similar system, just as a proof of concept really, to look at upper extremity movement in patients and to do some validation work ourselves to see just how accurate the system is. And we've expanded it to do a number of different exercises. So we've got, we've got abduction sizes, trying to remember the terms. But abduction, we've got adduction, we've got forward flexion, which is this one. We've got internal rotation, where the patient goes like this, holding the elbow into the body. And then we've got this one at the top, which is the rotation in abduction. And those are all measures that you might do in clinic. And we currently have a pilot study in Glasgow at Strathclyde University where we're collecting data to try to validate this and provide some more evidence as to the utility of this approach. But we see huge value here in having a simple solution that's portable, is cost effective, and it enables us to make objective measurements for things that actually in the past we've found difficult to do in clinical trials. Thank you.
Do you have any questions?
Looks like it's
I was just thinking, because I was just about to say before you said it, that the objectiveness that's the issue.
Yes.
So if you've got somebody who's making a subjective judgment on how much patient can move, versus somebody who can actually measure,
yes.
that's going to be a different type of data, isn't it? In terms of
Yes, potentially much more precise and eliminating some of the noise you get between raters, for example. So, yeah.
Thank you very much.
Great, thank you.
Up next is the hackathon teams who've been very, very busy over the last few days, and we're not lots of sleep, coming up with some new developments.